Good morning. My name is Bonjo Matugi Perez. Today, I will perform the bed batting. First, before the procedure, we should wash our hand and then close the window. If the window is already closed, and then prepare all the materials that you need, and then explain to the patient the procedure. Okay. Example like this. Good morning, ma'am. My name is Bonjo, your nurse today. Today I will gonna perform the bed batting. And after you tell the procedure to the patient, you should know the bed is you should up the bed. If the bed is high, then prepare the materials that you the materials that you need for your procedure. First, remove all things. First is we need to get the vital signs of the patient before we proceed to the procedure for bead batting. So we need to check the pulse of the patient first. This will be the most important if we bed batting the patient. If the vital signs is normal, so we need to prepare the materials. So we have two basin here, but let's assume that the one basin is like this because we have no basin. I forgot I buy earlier, but I hold only one. I get. So and then prepare the linens. So we should get first the linen. So this will be the materials that we need. So linen is the most important. Okay, we should add here the linens. So after that, we need to cover the patient, the blanket, and and we need to down the blanket or the patient's patient's linen, or shall we say the the spread blanket. We should down this first out, and then I cover first the patient with the blanket, and then we down this. So can you hold this, ma'am?
Yes.
After that, the blanket should down into the foot of the patient. So, and then the next thing to do is we should tell the patient that she remove here or the cloth of the patient. So as you can see, the patient should already remove the hair clothes, especially or the lab gown, and then we do. And the first is we need to check the water, the warm water. If the warm water is 43 to 46 degrees Celsius using our rest side. If if the water is at 43 to 46 degrees Celsius is normal, so we need to do the procedure already. So first thing to do is I need to wear my gloves. So we need to wear the gloves before we do the procedure. We use surgical gloves, not the sterile gloves. And then after that, we have already the gloves, we should wash first the face of the patient before we down into the lower part, because the first thing to do is we should wash first the face of the patient down to the lower of her body. So we have so we use we should have three face towel, because the one is for the soap with soap water. So this water, there's a soap already typed out inside, and then this will be the normal water, there's no soap. And then the third towel we use is for the for the wash after the washing for after the water, there's no soap. So we put inside, and then to fold the towel is like this, and then put into the waters with soap, and then the one should also the same procedure to the first towel. And then this will be the dry towel, which the dry towel is the last to wash the face. So after that, we need to do like this, and then then in this side first. So, ma'am, I wash your face in the eyes area, in the eye area, in the both side of your face. So same side into the other side of your face, and then put the towel into the first basin, and then the next basin is the water with no soap. After and then the dry towel. After that, the whole face, we need to wash her face. And use the second towel for the for removing the soap in her face. I can lay down your hand, ma'am. And then, the third is the dry towel. After that, in the head part, after in the face part, the next thing to do for the bed batting is in the neck part. I'm sorry because I use let's assume that I have a normal table here because our tables are small, using for the or only for the this is a small table, so let's assume it's a big high table. So and the next is the towel with normal water to remove the soap on here neck area. Can lay down your hand, ma'am, and also cover with the blanket. And then the dry towel. After that, after that, in here, in this side, in the axilla area, we need to put a towel in here in this side. So can you down na? So after that, we should wash the axilla area. And the dry towel. After that, we wash hair in this side. And we use this. And also the dry towel. So after that, we should wash her. The third is we should wash her fingers. And our patient is very responsive. And then the third is this towel, the dry towel. Because our patient is girl, so we should cover her breast area before we do the procedure. So we need to cover first the the breast area. Can I wash your breast part, ma'am? Okay. So after that, we should inform the patient if she can her permission if we wash her part the breast part area, because you know I am a boy, so we should ask her permission if she give her permission. So we need to down the blanket. After that, we should wash also the same technique. And then use the regular water, a towel with no soap. And also the dry towel. After that, we need to return the blanket to cover her her breast area. So, and the next thing to do is to wash her foot. So the next technique is we should get the another water and to replace this water, and we need to another warm water, the same degrees, 43 to 46 degrees Celsius. So we need to go to the CR. So the camera are still in there. I can bring it to the CR because we only have 2 person here, the patient and I think. So again, after that, the foot area. So I up the blanket. Can I get up her foot, ma'am? And also, I pat into in the joint area or in the heel area of the foot of the patient. So I used another water, so we need to put here the feet of the patient, then we need to wash. Can you your foot, ma'am? And then we wash her legs. Same technique in the first part. And then same also with with this towel. And then the dry towel. So after that, we wash her foot and also the fingers. And the fingers, the and then we need to down the blanket. And also, after that, after procedure, what I did here in this side, same procedure in the other side. After that, we need to get the lap gown of the patient or her pajamas. Because she is here in the hospital, we should providing here because she admitted in the private hospital or in the private room. So she need to wear a lab gown. So I give her lab gown. Let us sure that I give her lab gown. She wear her lab gown. And after that, the next thing to do is after in the lower part, we should wash her in the back area, in the back area of the patient. So, can you look at in the other side, ma'am? So, like this. So, same procedure to wash her back area. And the towel with no soap. And then the dry towel. So can you return here, ma'am? So after that, after in the procedure, I should give, let us sure that I give here what I said earlier, because she admitted in the private room, we should providing her a lab gown. Even in the ward area, if you are if you admitted into the private hospital, they will be provided a lab gown. So after that, we need to have the top linen, or should I say the top linen. So after the blanket should dispose properly into the disposable area. So we need to dispose properly. Then the next thing to do is we need to ask the patient if she feel comfortable now. What can you feel right now, ma'am? Are you feel comfortable?
Yes.
Okay. According to the patient, she feel comfortable right now. So, the first I need to remove all the materials that I need to clean the area of the patient room. So I need to get this back to the into the I remove, or I shall we say I clean this area. And also, dispose properly in this linen into the disposable area, and should be the linen can touch your uniform or lab gown because it's already contaminated with bacteria. And then if she and also after that I need to remove the 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 surgical gloves and dispose properly into the disposable bin. And we all know in the hospital there have three types, and the bin should be colored. The green is for the biodegradable, and the black is for the non-biodegradable, and the yellow is for the infectious materials like the gloves or the diaper, any kind. So we need to remove this, and then should do this. So this post. So after that, I should wash my hand. So let's assume that I wash my hand, and then after that, I need to for my wait. So after the procedure, I need for my charting, the charting for the on my procedure, the date and the time doing my procedure, and also I check the vital sign. Let's assume that I check the vital signs of the patient before I charting, and also in the charting I should write the procedure, shall we say the documentation of the procedure or the assessment of the patient. So that's all, and that's all. Thank you. This will be the bed bathing procedure.